Good evening, everyone. Today, I'm very happy to announce that we have merit list rank number 1 in clinical hematology from Marrow, and her name is Dr. Simi Tahiliani. So, welcome to the forum, Simi.
Thank you, sir.
So, Simi, rank 1 is a big achievement. So, everybody would like to know where are you from? Where was the UG and PG from? Can you introduce yourself?
So I'm Simi. I've done my MBBS from Zipper Pondicherry. I belong to the 2016 batch, and I've done my MD Medicine from Ram Manohar Lohia Hospital, and I belong to the 2022 batch.
Right. And in the field of gastro, cardio, why does one think of clinical hematology? I'm always, uh, excited to hear about that. Why did you choose clinical hemat?
So I was interested in reading hematopathology from Robbins in my second year of MBBS, and during my residency, I was exposed to various cases of hematology, and I was interested in knowing further about how they're worked up, what are the challenges in managing those patients, what are the new treatment modalities, and so on. So I decided to pursue this.
And if I understand correctly, RML doesn't have a hemat or medical oncology department. Am I correct?
No, sir, it does.
So, in spite of that, you were inclined to do clinical hematology. It's a big thing because at times I find students who have come from an institute where there's a hemat department, that is why they're interested. And at times I find students who still don't have a department, but because of the pure passion for the field, they have the inclination for the field. So that is very good and nice to hear.
Thank you.
So Simi, a very common question which students ask, or or the aspirants ask is, how many months of preparation is okay or essential for if you want to choose or pursue hematology?
Sir, I believe that this varies from person to person because different people have different ways of studying. For me, once I had decided on the branch, which was in the middle of my second year of MD medicine, I started preparing. I went through the videos multiple number of times. So for me, it was around 1.5 years. But again, different people have different ways of preparing.
Right. And when you go through a preparation in retrospect, uh, what was the sources of preparation? Some people are only for Anderson, some people are for specialty hematology textbooks, some go through the app. What was your combination?
So before I started my preparation, I watched a lot of videos of my seniors when you interviewed them to find out how to go about because like I said, I didn't have much hemat exposure, so I really didn't know where to start. And from what I understood, they had stuck to the same source, that is the Marrow videos, and gone through them. And later on, they had suggested using the ASH-SAP, the self-assessment program. So I did the same thing. I started by watching the Marrow Hematology videos, and I really watched them many number of times. I think I would have watched them 7 times from May 2024 till November 2025 when I gave the exam. I also downloaded the ASH-SAP book. I was only able to get the 7th edition, but I didn't use it because when I started reading it, I found it very voluminous. I thought there was a lot of information and I wasn't able to retain most of it. So I stuck to my hematology notes of Marrow. I went through them repeatedly. I also solved custom QBanks and I gave all the grand tests. And when I was reviewing the grand tests, the Marrow explanations gave a lot of tables from, I think, Williams Hematology and from ASHTAP as references. So I simply took a screenshot of each one of those which I thought were important and I repeatedly went through those again and again rather than reading the textbook.
Right. So you not read per se Williams from bound to bound or hardcover to cover. It was through the notes, some part of Harrison, and when it comes to the test, the explanations from that. Right.
So even before reading Harrison, I think I went through the Marrow videos maybe twice or thrice because I felt that I was not in a position to understand what was given in Harrison, without the videos, because the videos highlight what is important and what needs to be focused on. And that is something which I couldn't have done by myself.
Yes, the Harrison is meant to give a lot of information in a concise manner, but it is for us to spread it out and specify what is highlighting enough to be relevant for a student as such, and even in clinical practice. So coming to the exam, Simi, every time I feel that at times it is a bit of a jugglery. You have exams which are all simple or exams which are too difficult. So how was the exam this time? How would you rate it? How many did you attempt? And what is the difficulty level as per you?
So I attempted 79 out of 80 questions. And uh, for me, personally, the exam was moderate to difficult. There were many questions in the hematology part where I felt that if I worked in the department, I would be able to answer them better. There were a lot of
Uh,
judgment-based questions. So I found myself struggling with those, but I tried to answer to the best of my ability. But one thing which I had focused on was making my general medicine part really strong, because I felt that if there is a bridge, if there is a gap, I can, cover it through general medicine. So I think I might have scored better in the general medicine part rather than in the hematology part.
Right. So usually the approximate number of attempted questions is 72 to 75. After some increasing amount of time, I've come across a student who's attempted 79. So that is very good. This goes to show a difficulty level as well as the confidence level in the exam, even if it was a moderate to high level of difficulty as per you. So, Simi, after the step one results are announced, we did have a step two preparation webinar, short webinar, and how did it help you, or did it help you in any way? And what was the question which were asked to you in the interview?
So actually, when I made the decision that I want to take up DM Clinical Hemat, so I've been attending your sessions since then, even though I had not given the exam before, but I attended your stage 2 interview preparation videos since I think this was the fourth time that I attended it, or maybe the third, I don't remember, but I had a fair idea of what all things you had asked to cover. So I went a step further, and before my interview, I went through your MCQ recall videos as well. So you have two such videos in the app. I think each one is around 3 to 3.5 hours. I made it a point to go through those videos right before my exam because I thought that it might be helpful in some way since it covers everything in hematology. And in my interview, I was asked four questions. The first one was approach to malignant hypercalcemia, which I answered based on my MD knowledge. Second one was approach to clonal polycythemia, which I answered based on what I saw from your videos. The third question was, in fact, exactly similar to what you had told in those MCQ recall videos, a question on spurious macrocytosis due to agglutination, in which the counter records the MCV as 140, but actually it is agglutination. So that was like a direct repetition from there, and they asked me what should be done in such a case, that you have to pre-warm the tube and all. So I was able to answer that. And lastly, they asked me about a case of schistocytosis in pregnancy. So the discussion went towards PTP and causes of schistocytes, HELP syndrome, plasmic score and all. So I found that of course the preparation video the session that you took was helpful, but the MCQ recall video also helped me a lot for the interview.
Oh, nice. So that was a nice variety of questions in the interview, from malignant to benign, the entire spectrum. Right. So lastly, Simi, any messages for the future aspirants? Because every time I hear students asking that INI is too difficult as an exam. This was your first attempt and you cracked it in it. So any messages for future aspirants?
Uh, so again, everyone has a different way of preparing. So the only thing that I can suggest which worked for me, which I would like to mention a couple of things. First is that right before the exam, I made it a point to watch the recall videos all over again because you've stressed on a lot of things like the fact that multiple myeloma is frequently tested, the fact that they like to ask the side effects of various drugs. Uh, so in your videos you had mentioned about bortezomib, lenalidomide, and so on. I went a step further and I tried to find out the side effects of most of the drugs that I read about. And incidentally, they asked about gemtuzumab ozogamicin, which is, I mean, it was like a continuation of what you had told. So I would stress on watching the recall videos right before the exam because topics do get repeated. And the second thing was that I went through the update videos that you had recently uploaded in the app on CML, lymphoma, and multiple myeloma. And again, there were direct questions from there, including the R square regimen, which you had mentioned. That was new, and I didn't know about it. I saw it right before the exam, and then it got repeated. So that was useful to me. And lastly, a lot of my seniors had mentioned the ASH hematology question, the image bank, using that for image-based questions. So the only problem which I found with that was that it doesn't give a detailed explanation of every picture that it gives. So instead, I found the AIMS Hematology Image Bank more useful, which is a PDF that is available on the internet, which comes with a detailed explanation of every HPLC and peripheral smear. So I would suggest using that right before the exam for revision. That's all.
Right. That was very informative and would be useful for the future aspirants, Evi. So, last, before closing in, you are rank 1. So, you have the liberty to choose your institute. So, which one will you choose?
So my family is based in Delhi, so I would like to choose AIMS Delhi.
I thought so. So, good. Congratulations, Evi. And best of luck for your future. And hope we meet sometime soon in the near future.